Okay, welcome back. Good morning to all of my dear viewers. So in today's session, we are going to discuss a very important topics of community medicine, and the name of topic is control of tuberculosis. So in today's video, we are going to learn how we can control the tuberculosis. So according to the park textbooks, there are some method for the control and the prevention of tuberculosis. Now we are going to discuss all these methods one by one. So what written according to the park textbooks? According to this park textbooks, they say that we can control the TB by two methods. So what are the two methods by which we can control the TB? One is that a curative methods and the another is preventive methods. So what is the difference between these curative methods and the preventive methods? In curative methods, we first identify the TB case and start treatment. So by identifying the TB case and the treatment, if we control the TB, it is called curative methods. And what is this preventive methods? In preventive methods, we give BCG injection to all the population and chemo prophylaxis. And the name of chemo prophylaxis is the isoniazid given to the vulnerable population. So by with the help of these curative methods and preventive method, we can control the TB. So in this session, we are going to discuss the curative methods, and I already told to you they are the two components of the curative method. One is the identify the case and the second is treatment. So overall in this session we are going to discuss how we can identify the TB case. So this is the key point of lecture, how we can identify the TB case. So what are the different methods by which we can identify the TB case? So mainly there are 2-3 methods by which we can identify the TB case. One is the passive surveillance, and another is active surveillance, and the third is with the help of some tools. So what are the difference between these three? We start with the passive surveillance. Passive surveillance means what happens in TB case, the patient develops the chest pain and they having a fever, chronic cough with a sputum more than 2 weeks. So these are the common symptoms of the TB patients. So if any hospitals or any clinician, this patient itself go, I mean if any clinician or hospital, if any patient goes and they say these symptoms that sir, I having a chronic cough for more than 2 weeks and sputums and chest pain and fever. So here patient itself goes to the hospital. So whenever patient itself goes to the hospital, it is called passive surveillance or passive case identify. The second is intensified case identification. This intensified case identification is also called active surveillance. So what happened in case of this intensified case identification or the active surveillance? Here 2-3 things will be done by the health worker. First things that they sent invitation to the vulnerable population that in your area a TB camp is held. So please visit the TB camp for the TB testing. So here by the way of sending invitation to the vulnerable population, they can search the TB case. The another things is that another things is that provider initiative testing. So what is this provider initiative testings? In provider initiative testings, it is told to all the doctor of country that whenever any patient of HIV, diabetes mellitus, corona came to your clinics, ask them 4 questions. What are the 4 questions? The fourth question is, do you having weight loss more than 10%? having night sweatings, or chronic cough more than 2 weeks, or blood in the sputum. So these are the 4 questions that must have to be asked all the patient, or not all the patient. A patient who having a diabetes mellitus, HIV and corona came to the clinic of doctor. So after asking all these 4 questions, if any of the question answer is yes, then take the sputum samples of the patient and directly send for the CV NATs. So this process is called provider initiative testings. Okay, so after discussion of this, one more method is that one method I already discussed, that health worker sent invitation to the vulnerable population to visit the TB camps. The another way what they do, they can go to the vulnerable area and door to door they take the sputum sample and send for microscopic examination. The fourth things is that identify the case with the help of tools. So what are the different types of tools help for the identification of TB case? One of the most preferable tools is the microscopic examination. So in microscopic examination, we can go for the Jaden smear or the fluorescent microscopy. So for this Jaden smear and the fluorescent microscopy, first we have to take the sputum samples, and we basically take the 2 sputum samples. One is at sports and another either we takes 1 hour of the sport sample or the next early morning. So after the microscopic examination, there are some other way for examining the case. The second most important way is the rapid diagnosis. In rapid diagnosis, it includes the CV NATs or the true NATs or probe. What is it written? Line probe assay. So in rapid diagnosis, 2 things are included. One is the CV NATs or the true NATs, and the second is line probe assay. Okay, after that some other methods, like we can identify the case with the help of chest X-ray. We can identify the case with IGRA is in interferon gamma assay, in which interferon is the cytokine. Basically it is a blood test. So with we can detect the interferons level for checking the case is positive or negative. One more important test is the tuberculin test. Tuberculin test example is a Montauk's test. So what happens in case of this tuberculin test? We can inject the tuberculins and wait for the 72 hours. After 72 hours, there is a formation of induration due to the inflammatory response, and with the help of ruler we can measure the size of induration. So if the size of induration is more than 10 millimeter, it is considered as the positive case, and less than 5 millimeter negative case. And if the size of induration is in between 5 to 10 millimeter, it is considered as the doubtful. So these are all the different methods we can identify the case. What about the treatment part? Treatment part we already discussed. You can visit my YouTube channels, and in playlist you can see it. Okay, so whatever I discuss here, the same things is written on the boards, and we are going to discuss one by one. Control of tuberculosis. So what is the meaning of this control of tuberculosis? Control of tuberculosis means reduction the incidence and the prevalence of the disease in our community. Okay, so having a 2 component, by 2 way we can identify the, control the TB. One is the curatives components, which include the case finding and the treatments, and the next is preventive components, by which the BCG vaccination and giving isoniazid as a prophylaxis we can control the TB. So in curatives components, there are the 2 things. One is the case findings and another is treatments. So what are the method of case findings? In case findings, there are the 2 methods. One is the passive case findings and another is intensified case findings. So in passive case findings, the patient it itself visit to the clinic or hospitals with a symptomatic condition, while in the case of intensified case findings, the health worker visit to the vulnerable population, or no, there is the provider initiative testing by which they can identify the intensified case. So the first is the screening strategy. In screening strategy, one is the community strategy and the institutional screening, also called provider initiative testing. So in this screening strategy, there are the two ways. One way is that they send invitation to the vulnerable population, and the next way is that they itself visit to the vulnerable population and take sputum samples. Provider initiative testing में all the clinician asks whoever the patient visit to his clinics having a pneumonia, diabetes mellitus, or corona patient asks for things: severe weight loss more than 10%, night sweating, cough more than 2 weeks, blood in the sputum. If anyone question answer is yes, then send his sputum sample for CB-NAT. Okay, case finding with tools. Okay, so with tools, the one is the preferable method for case finding is the microscopic examination by the Gaussian stainings and the fluorescent stainings. Second, go for the culture in solid LJ medium and the automated liquids like backpack and Megit. Rapid molecular diagnosis having a CB-NATs and TrueNATs, line probe assay. We can also go for the chest X-ray, tuberculin skin test, example Montague's test, and the interferon gamma release test called IGRA. It is basically a blood test to detect the cytokinin interferon in the bloods. So what is the Montague's test? In Montague's test, one tuberculin of the purified protein derivatives. In Montague's test, one tuberculin units of the purified protein derivatives injected in the forearm, flexor components in the left forearms. Formation of the induration, and on the basis of size of induration, we can predict patient having a positive or nodes. If size of induration more than 10, it is positive, less than 5 negatives, and between 5 to 10 doubtfuls. So this is basically a screening test, not a confirmatory test. We can confirm the things with the help of CB-NAT. So this all about the case identification. I hope you can understand the lecture. Okay, see you in next video.